General anesthesia, you're asleep. That implies, again, that you're having a, more often, a traditional liposuction procedure done. Those instruments are going to be upwards of 7 to 9 to actually 1 centimeter in diameter. They're going to be sharp. They're going to be hooked to suction. The doctor has to push, jab this instrument through your tissues. Everybody knows of the video that they see on YouTube or Health Channel or Discovery of this doctor jamming something through. It happens every day. Okay, it's still a very common way to do liposuction. That doctor is putting fluid into those tissues, not really local anesthesia fluid because you're already asleep. He doesn't need local anesthesia. He needs a ton of fluid to go in there to stretch the tissues. So then when he's jamming this thing through, there's enough tautness on the tissues so it cuts and slices through more easily than if there's too much give. You have to imagine a doctor pushing something through tissues with a lot of resistance. The doctor can only do this for so long. I mean, I've talked to plastic surgeons who have done traditional liposuction, and they'll basically change their scrubs between cases because they're sweating so much. I mean, it's a hard procedure for them to do. It's a lot of trauma for you to experience. And because of that chunking and cutting that goes on with this traditional procedure, you have more bleeding post-procedure, more bruising post-procedure, more pain post-procedure, more downtime post-procedure, potential for irregular results post-procedure, waviness to your tissues. It's not a good exchange of your cash for that kind of result and that kind of experience. I mean, you can either be awake for a surgical procedure or you can be asleep for a surgical procedure. Obviously, you're asleep, that's called general anesthesia. For awake, for our purposes, is called two-method anesthesia or local anesthesia. General anesthesia has more inherent risk than being awake. There's the risk of the medication. There's risk of putting a tube down your throat. There's major complications of interaction of drugs during a general anesthesia procedure. There's a significant death rate with general anesthesia that the population really doesn't know about, but is still out there. So it's not just a safe procedure, everybody goes to sleep, everybody wakes up. Occasionally that doesn't happen. So to be awake for a procedure is much safer. Obviously in an office-based setting, that's your only choice. And you're only putting anesthesia in the area that you're treating. So there's nothing systemic or whole body about what we're doing. It's all localized to the area that we treat. So it's a safe, extremely safe form of anesthesia, extremely safe way to undergo a procedure and get the outcome that you're looking for, be able to walk in the door, walk out the door, go home with minimal downtime and back to work as soon as you need to be back to work. Well, it was interesting. I did a gentleman, actually as a CEO of a company, and he actually gave me a testimonial about his procedure. And one of the things that he brought up, and actually in retrospect I've heard from other patients, is that he was able to know that the area that he wanted worked was actually being worked because he was awake, and for him, he was watching the procedure. Some patients don't want to watch, some patients will watch, but at least you're sure that I'm paying for this area, it better be done. Because I've had patients come in after having liposuction done in a hospital-based setting, general anesthesia, and they'll tell me, well, I had my belly and my sides and my back done, and I just didn't get the results I should have gotten, I thought, from my back. My belly's a little bit irregular, but my back and my sides don't look like they've been done. And I go look for the incisions where they should have entered to do the procedure, and there are none. So, I mean, and I'm not saying this is a attempt to rip patients off by their doctors. I'm just saying that I don't think sometimes all the areas are done as thoroughly when you're asleep versus the knowledge that, well, I want the area done, I'm awake, he's doing the area, obviously I'm getting what I want. So it's just a way of assuring you're getting what you want for the price you're paying. He was actually watching his whole procedure thoroughly. He was very interested in how it was being done because he had traditional done before, and he wasn't happy with the results. And this way, I mean, he could actually direct and say, at this point, this is the area you're doing, this is what wasn't done properly, and I want to make sure you're doing it right this time. So he could watch the area, watch it go down in size, and be very pleased that it was being done and done to his specifications.